My name is John Caviness. I'm a professor of neurology at the Mayo Clinic College of Medicine in Scottsdale, Arizona. The purpose of the study was to see if we could use the measurement of brain waves to predict with higher certainty who with Parkinson's disease would develop memory problems, concentration problems, and other cognitive difficulties. In previous work, we had demonstrated that brainwave abnormalities could measure and correlate their abnormalities with the degree of memory problems and cognitive problems in Parkinson's disease. After that study was completed, I began to think as to whether those brainwave abnormalities, or at least a subset of them, could predict the subsequent development of memory and other cognitive difficulties in Parkinson's disease. Using the Brain Bank study in Sun City, Arizona, in which we study healthy individuals with various kinds of problems, such as Alzheimer's disease, Parkinson's disease, and other illnesses of aging. We performed a study where we measured the brain waves of individuals with Parkinson's disease. Then, from year to year, we repeatedly measured or assessed what kind of memory function and cognitive function they had as time went on. We then correlated the degree of brainwave abnormality in the very beginning of their history with the disease, and correlated that with whether or not they developed more cognitive problems later on. We found that certain types of brainwave abnormalities, but by no means all, could predict who is at subsequent risk for developing dementia, as well as other degrees of memory and cognitive problems. Now that we've done that, we hope to apply it in two different ways. The first way is rather theoretical. Now that we can detect very early physiological changes in the brain waves of those who subsequently develop memory problems, we want to see if that correlates with any biochemical finding or any type of cellular finding that could give us some insight as what is behind the cause of thinking and cognitive problems in Parkinson's disease. A second way that we would like to apply these results is to use the results in studies where the treatments for cognitive problems with Parkinson's disease are being tested or evaluated. If we use these brainwave abnormalities that we've documented in this study, we can recruit those individuals that have more risk for cognitive decline of Parkinson's disease. This will allow us to do these studies, faster, cheaper, and with less subjects than what we otherwise would require. We hope that this would result in finding effective treatments for the memory and other cognitive problems of Parkinson's disease significantly sooner. If we can isolate the biochemical or cellular changes that start off and portend, if you will, the development of the cognitive problems, then we know what targets we can gear the treatments for. That then either counteract those biochemicals or maybe help other biochemicals prevent the action of those steps in the biochemistry of cognitive decline of Parkinson's disease that can be a foundation for its treatment. Currently, if you have somebody who is having cognitive problems in Parkinson's disease and look at their biochemistry, there are a lot of potential molecules and biochemistry changes that are present once the cognitive and memory problems have had a chance to fully develop. However, if if we can detect these early by using these measurements, then that would allow us to narrow down the amount of biochemical abnormalities that really are present at the very earliest stage, and thus allow us to more pinpoint the cause of the cognitive problems in Parkinson's disease.